All right, to Nigeria, where resident doctors in Nigerian Republic hospitals began an indefinite strike on Monday over grievances that include the delayed payment of salaries and allowances. The doctors' union said as the country faces rising COVID-19 infections.
Please. On the protocol.
Some of our members are being owed salaries of up to 10 months, some up to 8 months at the state tertiary institution. And we believe that as we speak, what I get and other health workers is 5,000 as hazard allowance, considering the enormous hazard we are exposed to. This, we believe that even federal government is playing politics with it, with the issue of the improved hazard allowance, which is not proper. Thinking about the third wave and the Delta variant. But the truth of the matter is that there's no better time to say we want to proceed on a strike action, because we can only give our best if all the enabling environment is provided, and that enabling environment include our welfare, which borders on remuneration that is due us.
They need to consider the plight of the masses. People go to government hospitals to access cheap services. If they're not there, who will take care of them? The doctors may be justified in their action, but they need to rethink their position because of the plight of the masses. And I think that's the core of their profession.
So let me bring in Solomon Elusuji on the Nigerians' doctors' strike. And Solomon, thank you for joining us here on Bottom Line Africa, just to talk to us about the Nigeria's doctors' strike. And many have seen it as a way of just taking back the country when it comes to the gains made by the government in terms of the COVID-19 pandemic.
Yeah, Brenda, thank you for having me. Definitely, it's a very worrying sign for Nigeria, especially as the country is experiencing what seems like a third wave. The doctors, the resident doctors especially, have gone on strike serially during the COVID pandemic, and making most of the same demands, right, on paid salaries, on paid allowances. Last year, they went on strike about 3 times. This year, they went on strike in April.
All right. I do apologize for that technical hitch that Solomon Elusuji is having on his side. We are having a virtual interview with him on the Nigeria's doctors' strike, which began on Monday. They're talking about payment of salaries, allowances. That is what the doctors' union wants the Nigerian government to address, even as the country is facing the fourth wave, as you've heard it from Solomon Elusuji. The country is facing the fourth wave of COVID-19. So clearly, taking back the country into when it comes to the gains they've made because of the doctors' strike. Once we get a hold of Solomon Elusuji, we'll continue having that discussion with him. But then let's talk about the Biden administration to repeal 2002, where the Deputy Secretary